We are still dealing with the after effects of the Wuhan virus. Many are still not over the trauma that was caused by the COVID-19 pandemic. And yet another deadly infection is on a rise. A highly drug-resistant fungus is spreading at an alarming rate in the United States. It is called Candida auris, and it is targeting those with a weak immune system. Should you be scared? How long before it infests your country, your city, or your neighborhood? Let's just tell you more about the fungus. Candida auris is lethal. Its infection is hard to treat. The invasive yeast strain was first discovered in Japan back in 2009. A 64-year-old was diagnosed with otitis externa. It is a severe infection of the ear canal. The patient's ear discharge contained this fungus. It was found resistant to multiple antifungal drugs. And since then, the yeast has been reported in 17 countries across 5 continents. In fact, it found its way to the US in 2013, and by 2016, it had claimed 4 lives and made 9 people extremely sick. All of these patients had some underlying medical conditions. The fungus was as mysterious as it was deadly. But one thing was absolutely clear, that people with fragile immune systems were at high risk. In June 2016, Centers for Drug Control and Prevention issued a clinical alert. It requested the laboratories to extensively research the fungus. But to date, very little is known. And here is what we do know about it. Number 1, Candida can cause fatal infections in the bloodstream, heart, and the brain. Between 30 to 70% of infected hospitalized patients are estimated to die. Number 2, Candida auris is multi-drug resistant. That is what makes it so lethal, because treatments just don't seem to work against it. Drugs commonly used to treat Candida infections are futile. Some strains are resistant to all classes of antifungals. Number 3, the fungus goes undetected in a majority of the cases. Standard lab methods fail to identify Candida auris. It's very often misidentified, in fact, and this in turn leads to wrong treatments and mismanagement as well. Number 4, the fungus has caused outbreaks in healthcare settings. It has been found in long-term care hospitals, in nursing homes with patients on ventilators, and cancer patients on chemotherapy. And by the way, it is spreading at a concerning rate. And we don't mean to scare you. The CDC has again issued a fresh warning in the Annals of Internal Medicine. Just have a look at these figures. Infections have tripled in the US in just 3 years. In 2019, 479 cases were reported. In 2021, they increased to 1,471. 2,377 clinical cases and 5,754 screening cases were reported in 2022 alone. A number of people carrying the fungus but not showing any symptoms quadrupled in the same period. It went from 1,077 to 4,040. Candida auris has now been detected in more than half the states. 17 states identified their first case, in fact, between 2019 and 2021. According to the European Centre for Disease Prevention and Control, 8 European countries reported 335 infections in the year 2020. And that figure increased to 655 reported in 13 countries in the year 2021. And most of these cases were found in Spain and Italy. But as I said, the fungus is difficult to detect. So these are just the cases that were caught by the doctors. The actual numbers could be much higher. And here comes the worst part. If the fungus gets into a hospital, it's very difficult to control and eliminate. It persists, smolders, and causes infections for a considerable period, despite the best efforts of infection control. And above everything, the fungus continues to evolve. It is shape-shifting. It forms biofilms to resist the disinfectants. It's learning to survive in a warming world, much like the fungus in the HBO drama Last of Us, and it's difficult to not draw these parallels. By now, especially after the Wuhan virus pandemic, you might have observed a pattern when it comes to these pathogens. They start out extremely rare, and then they emerge in more and more places, and ultimately they become widespread to the point that lockdowns are imposed, economies suffer, and everything comes to a halt. Could this be the beginning of the next pandemic? Could the fungus find its way to your neighborhood? Even if it does, those who are healthy would not be at much risk. But if you suffer from chronic medical conditions, then you might want to take some precautions. WION now available in your country. Download the app now. Get all the updates on the move.